most famous physical therapist on the internet.
Liz wonders if we're ready. Brad, are you ready?
I'm ready.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heine, physical
Together we are
therapist.
the most famous physical therapists on the internet.
In our opinion, of
If we're
course,
ready,
Bob.
we should be able to enunciate if we're ready. Right?
Enunciate or pronunciate?
Today we're going to talk about after knee replacement, 2 critical exercises you need to do. Plus, we're doing a giveaway, Brad.
Oh, really?
So if you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away. This week we're giving away, this is going to fit with this video, we're giving away the Bob and Brad Knee Glide.
Absolutely, Bob. You can't go wrong with the knee glide.
If you have any surgery, knee surgery, you're going to want to know about this. You can also find it on Facebook. It'll be pinned to the top of the page. Go to Twitter or Instagram or TikTok if you want a 60-second version of our program every day. That's all you can put up with us.
That's right.
So Brad and I, between the two of us, we have seen literally thousands of knee replacement patients.
We've not just seen them. We've worked with them.
We've worked with them
very closely.
So, Brad, I don't know how you do things. God only knows how you do things. But the way I do it, the first session I sit down with a patient, I give them 3 pieces of advice.
Don't you say hello?
Oh, I say hello.
Okay.
I go, first, don't see Brad. No, the first one is do not listen to other people with total knee replacement.
That is huge.
Yeah, because these other people, one, they have poor memories, so they think they did better or worse than they did.
Right.
They're going to give you some advice that probably maybe not is no longer up to date, or
it's not relevant to them because
it's not relative to them.
Could be very different circumstances.
Right. So I always say to people, if you have both knees done, you're going to find out one's going to be way different than the other.
Yes,
I mean, it's just it's always a different experience. So, number 2. Now these are bonus, by the way. I'm going to get to the critical exercises yet.
Oh yeah, this is like
our babbling,
the introduction.
Yeah, number 2, do not progress to a cane or no gait aid too quick. A lot of times people are thinking, I want to get as fast as I can. I want to get to a cane instead of a walker, or crutches instead of
there's no races. Just take your time.
You can get worse.
Listen to your therapist.
You can set you back if you can start weight bearing too soon.
Right.
With that.
And if you don't like to listen to Bob, come to me.
All right. And number 3, and this is what this video is about. I say a lot of them people they come from the hospital and they have like 10 exercises that are given. They're all good exercises.
Right.
I recommend all of them. But there's 2 of them that I want you to focus on.
This is true.
So if you're busy, focus on those 2, and then if you have time, do the other 8. The other exercises.
Right. Or they may be the ones you emphasize more than the other ones.
You definitely don't want to skip these. These are the ones I always tell people do them at least 3 times a day, and spend the time. So we'll go over those.
They're the game changers that are going to give you success.
Yeah. One of the reasons, and these are about motion, by the way, is the exercises. We want you to get your bending back of the knee. And we want you to get the straightening back of the knee. Your strength is going to come and your ability to walk is going to come.
Right.
But how much movement you get in your knee is not guaranteed. And according to Dr. Lawrence in Viroqua, the big guru.
Right. He's a master.
He's locally one of the best orthopedic doctors around. Everybody wants to go to him for their knee replacement.
Right.
He told his patients, and I had one of his patients, said, it's a race against scar tissue.
Sure.
You're trying to get the motion back and solidified before that scar tissue really sets in and you no longer can get the motion.
Right. And you might have heard stories about having to go back and get manipulated, which does not happen very often.
No, it doesn't.
But it does, and it may be different reasons, but
it's not always your fault by any means.
Oh, no.
Right.
No.
Sometimes just your anatomical makeup, the way things your body responds.
There's things you cannot control.
So it's not to say that you got to go crazy on this because I've gotten people that didn't have therapy for some reason for 2 months, and we were able to still get some motion.
Right.
But
did we get to the exercise yet?
No, we're going to start with the exercise. So we want to work on getting it straight and getting it bent. Should we talk about straightening first, Brad?
Yeah, let's do that.
So for straightening, very simple to do. All you got to do, Brad's going to show it with the knee glide too, but I'm going to show you what I tell people is I start off put in there, you're going to put your foot up on a stool 3 times a day. I usually for about 5 minutes.
Yep.
And what I like is you go ahead and you just let gravity do its thing.
Right.
Now, if it starts to feel like too much, give yourself a little break.
Yep.
And bend it a little bit. That's why I like these rolling stools, Brad.
I was just going to say, that's what I like to have my patients on. If you have an ottoman, like in your living room with rollers on, or another chair in the kitchen, whatever works in your house.
You can even get a little movement like this going.
Yep.
And then just let it stretch for a while. And if it gets to be too much, you just bend it. And after a while, if this becomes too easy, then we have you put a little weight on, a little above the knee.
Right.
You can use your hand, or you can just take a weight.
What I do is I have people put their cold pack on there.
Sure.
And that way
that adds a little weight.
It's pain management and extension, range of motion at the same time.
I've had ladies put their purse on there because sometimes their purse weighs a couple pounds. So I have. I said, you can take your purse.
Yeah, and they did.
Yeah, they did.
Oh, wonderful.
Yeah, how wonderful. So you can also work on extension with the knee glide.
Right.
Or even work on it this way.
Yeah, this does work. It's kind of like the wheels on the roller. You can stretch. Let me give a better angle so you can see the.
Right, and that's the whole thing. You can get some movement in there while you're, because what we have found that people want to be under control. First off, they don't want me stretching it. They want to stretch it. You'll get a lot more.
You're more relaxed. Your body doesn't tense up. And Bob mentioned it before, but I want to emphasize, if you're going to help put some pressure down, make sure you go well above the knee.
Right.
You got the incision that could irritate the kneecap. That's all painful. Bring it up here and stretch. Relax and breathe. I'll have my patients, I'll say, take a deep breath in and exhale. And as you exhale, let everything relax and push until you get it straight.
So I have people, I don't know what you recommend, Brad, but I have them 3 times a day for 5 minutes on extension and 3 times a day for 5 minutes on flexion.
Right, that's a good program.
And then you can add in the other exercises.
Sure.
Now for bending the knee or flexion, a lot of people just put the towel on the floor and go back and forth. Now one thing you notice, if my foot starts coming up like that, it's not ideal for extending. But and there's a little more friction with a towel on the floor.
And on carpet at home.
On carpet doesn't work.
It doesn't work. And actually, what you're getting into, Bob, is that's why we literally invented the knee glide, because we knew there was something better to help promote range of motion with the knee in the clinic as well as at home.
Right.
So, we got this nice knee glide that goes very, very smooth, and we can bring it back and get that bend and then forward.
Well, what's nice about this, it goes up on the...
Right, and this is a big advantage.
This is a big advantage.
Yep. So, and it's something about the ankle. We haven't quite, figured it out, but it just is more comfortable when you have it on the incline.
Yeah.
And then as the knee progresses and as you get later in the rehab, and you want to strengthen more, and this can help the bend too. You just simply flip it around, and you can see I get more flexion, more bend, and you're working the hamstrings more.
Well, the big thing, Brad, that I used that really made a difference. In fact, I had one patient who was stuck, and it's funny. I saw her before we had the knee glide, and we got stuck. We couldn't get past, I think, like 90 degrees, right angle, and we had the knee glide, and this is the one I was doing with her. In fact, I was just keeping it flat like this, and we were having her go back and forth and get it loosened up.
Yep.
And then she'd take her other ankle and pull back like this.
Right. There you get that assistance.
Yeah, and this made all the difference. So she'd go like this, back and forth, and then every 20 seconds or 30 seconds, I'd have her take the other ankle and stretch it. And
now, and I was going to say, I've had I've been guilty of it. I don't know if it's guilty because, get down there and the therapist will push. But I think that person you almost kind of push against it. That the mind will they know it's going to hurt, so the mind automatically pushes against, and you lose ground. But when you help yourself, the body relaxes.
You're in control.
Yeah.
Now you got to push yourself through some pain. This is one of the few exercises where we actually say you got to have a little bit of discomfort. You push into the pain.
Right.
And not to say Brad and I don't go in there and help sometimes. We still do.
Right.
We still go in there and stretch.
But we emphasize being independent.
Yeah, being independent, and really you don't want to get it so painful that it reacts and the muscles tighten up to protect it, to splint it.
Right.
So 5 minutes a day, we have them work on, or 5 minutes 3 times a day. I have them work with this.
Yep.
And I've gotten to the point now, Brad, when I'm seeing outpatients, I send one of these with.
Right.
I mean, I have a bunch with, because they just do so much better.
Right.
So,
and we actually got an orthopedic clinic that is going to give one with every one of their patients now. They're wonderful. They've got great ratings, and there was something else I was going to mention.
They're lightweight.
Oh,
I mean, I mean,
you could put that in your purse if you had a big enough purse.
Well, look at this. You can curls with your finger.
I believe it's 3.1 pounds.
Yeah. So, I mean, it gives you no excuse. You can use it wherever you are. You can probably do it in the car.
Yeah.
So.
Not that we want to promote them or anything.
No.
There was something else I wanted to mention. It was really important. It wasn't really important.
This is the man that left his socks in the refrigerator. We got to remember that. He couldn't find his socks, and you found them in the refrigerator, or was the freezer?
It was the refrigerator, Bob. Why would I put them in the freezer? I don't know why you had to bring that up. Now my wife is going to find out.
Remember, Brad and I can fix just about anything.
Except for
a broken heart.
Well, this isn't going to help.
And apparently a bad memory, too. We have trouble fixing that, too.
Yeah, what time is it? We got to cut off.
Thanks for watching.